Well, if you have a government health care program, Medicare, Medicaid, something like that, and what's happening now, see, particularly on Medicaid, what they did is during the pandemic, they let more people come on and they didn't check anybody for 3 years, and they just said, stay on it and we won't bother you and everything. So now we build up all these new applications, or coverage for Medicaid. And now the piper is over, or the parade is gone, or however you want it. So now they're trying to eliminate people who are not eligible. See, during the pandemic, there was a certain requirement, and now after the pandemic, there's another requirement. So if you're not eligible, they're just going to kick you off. And what they're doing is just going through the computer, and any data they have that shows that you're not eligible, they're kicking you off. And actually, the Kaiser Foundation is a great source of information and data on our healthcare system. Well, they say that between 8 and 24 million people will be kicked off the Medicaid rolls, okay? That's probably about the amount that joined, that we had a low uninsured rate because they all got Medicaid. And now they're going to be uninsured again. But the problem is they estimate that 50% of those people are eligible now, and so in other words, if you take the high number, 24 million people they're going to kick off, and 50% of those are eligible, wow, that means 12 million people get kicked off who really should not be. Okay, so now what are you going to do if you're on Medicaid? Okay, well, here's what you do. You got to check your data. And it's probably a pain in the ass to do it, but tell you the truth, if you're going to spend some time doing this, it's better, than a $10,000 hospital bill that you're going to have to pay. And who knows if you're even going to find out if you're covered or not. So you better find out. And the way to do that, it depends. I think the best way is to find a community navigator. Community navigators are something that the government spends money on. They spend $100 million for, I think it's 90, lots of people, lots of organizations. 59 navigators. Okay, the navigators are not nonprofit organizations that help you for free understand this system. Man, I've worked with some immigrants here and things like that and helped a lot. I can't understand it, so you got to get help. And the way to do it is use one of these community navigators. Wait in line, do whatever, because you're not going to understand the system. I don't, and I understand. I've been studying these kinds of things for 50 years. So you want to get a hold of a community navigator, and to find them, you could go to, well, actually, I have a link here. I'll put in the description a link of all the 39 community navigators. And the community navigators are organized by state. So you could go to your state and find one in your state, because all the states have different laws and regulations. So that's the problem. You need to go by the United States. So here's Alabama and all the community navigators. They have a phone number, email, and everything. Okay, another way to do it is healthcare.gov and find community navigators that way. Because this list does not have all states, because some states have their own database. See, it's even complicated getting a community navigator. So if all this fails, what to do is go to your county Department of Health. You want to go to your county Department of Health, and you do this by going to the Association of Counties or Health Departments, and it's naccho.org, naccho.org. And they have a big directory, all the health departments. Call your local health department. They'll know about community navigators or whatever else they have to help people one-on-one with this situation, because people, they're just going to kick off 24 million people, up to 24 million people, and half of those should not be. So the only way to do it is you. You have to take the initiative. find out about it, and it's going to take work, and I gotta get either in person or on the telephone to make sure you find out what to do. So you're going to have to spend some time. Living in our complicated society, that's what it means. It's not easy. They try to make it easy, but no matter how hard they try, it's almost useless. So just get ready to put in some time to do it, unless you don't care and you don't need health care. But you're going to bust your butt to try to get a good job to pay health care. So spend a little time trying to make sure you keep your health care. And that's the important thing. So all the links are in the description if you're watching this on YouTube. And don't forget, we have grants we give out every month at Let's Go Help. We train you one-on-one, as much one-on-one help you can take, and live video grant training workshops we have every week. And we give out over $70,000 every month to members. You just tell us what you need money for, up to $1,000, and we review all the applications and give out to about 120, 130 people now. Get grants from us every single month. That's a lot of money. It's like $500,000 or more, over the year. And a lot of people even don't pick it up. I can't understand. Bizarre, but there's a lot in the world I don't understand. So let me understand you, and let me help you how I can to get the benefits that you have just by living in America. Man, I've been studying this for 48 years. I want to make sure I get out of me and into someone else who could really use it as much as I can. So please, give me a chance to help you.